I was coming to that only, Dr. Viren, that we as the students enters the first year of medical school, okay, and they want to know about the resources. So what are the best resources? Like we have many resources out there for anatomy and histology and embryology, everything. So can you curate some of the best resources for us, and also at the same time giving highlight about your application and your YouTube channel?
See, I cannot do my self marketing, but
I know,
students
but
know
to be very
me.
honest, I know I was your student, and I personally have watched most of your osteology videos. And
Okay.
after that, I while I was in second and third year, you launched your histogram app, and that was also like a
That
commendable
is
thing.
still available then, and that is
Yeah,
free of cost. Just for the same reason, I'm keeping almost my all resources free of cost, except few. Almost all the resources are free of cost, just because I want to give a chance to all the students for all the possible resources. At least they should get equal chance. Now it's up to them to utilize them or not. It's up to them, but at least students should not be deprived of resources. So that was my idea behind.
right, right,
Apart from my channel or my application, there are so many other resources in the form of YouTube channels, videos.
right.
Like most of the students would be knowing Dr. Najib and all. Okay, almost all the topics are covered. Like many other channels are there. I'll put down. I will put a list in a description. And regarding certain books, regarding certain applications, particularly for USMLE aspirant, I want to emphasize on that the guy who is talking with me right now, Dr. Apurva, has recently launched his USMLE strike. So for the USMLE aspirant, that can be a very useful resource material. For first MBBS student, the reference books available, or at least basic books. Nowadays, it's very strange to know that students are not buying basic books. Even they skip buying histology book, they skip buying embryology book. They are relying upon notes, they are relying upon
Yeah,
journals, log books and all. They
right,
don't
right.
even buy a book of basic sciences. That is very strange for me. I mean, it's not like you will buy it and you don't need it. You will need it throughout. It's not
So
like that.
what resource do you recommend, like basic books for first year as far as the anatomy is concerned?
Anatomy is concerned, most of students are preferring gross anatomy by BD Chaurasia or Vishram Singh. Vishram Singh is equally nowadays very important. So
Right.
much of content has been given to it. So Vishram Singh or BDC, either or, they can go through it. For embryology, Inderbir Singh or Brijesh Kumar or AK Datta is very useful.
Right,
AK Datta is bit of reference book kind of, but if you want to go through the concepts, then it's very useful. Even for gross anatomy, I used to read AK Datta. So
right.
for clearing concepts, very useful. For general anatomy, BD Chaurase and Vishram Singh is enough. For histology, what I personally reading was Brijesh Kumar. I don't know
Right,
it's easily available or not in
right, right,
PDF,
right.
but one can always go through online. They can get
Mhm.
the hard copy. Even they can use my histograms application that is free for histology. Almost all the diagrams and microscopic images they have been given
Oh,
free. They can see some videos related to the slides into that.
right.
Even I have myself uploaded in my channel histology videos of the slide. So if they miss one or two practical, they can see the videos of that particular slide and they can understand the histology again in 4x, 10x, and 40x magnification. In all
Wow.
three magnification, I have uploaded almost all the histology slides in form of video microscopic view, so they can go through it. Apart from that, for physiology and biochemistry, again I'll put a list of the books available.
Okay. And there are
Which
also some atlases available. What atlases do you prefer
for
to
histology,
refer?
D Fiore Atlas is good for histology. And
Uh-huh.
for, yes, particularly for dissection, if it is available at present or not, but Ackland Atlas is
Yes, yes.
way ahead of its time.
Right.
Extraordinary dissection, and that dissection was done at, I think, -6 degree temperature in freshly prepared cadavers, fresh cadavers, and that is bit processed just because you won't find any fatty tissue. So very clear cut, very neat and clean dissection, and it's worth buying Eckland's anatomy videos. It
Yes, I
was
think there's a
available in the
website
form
for
of
that as
DVD.
well.
it was available in the form of
Yes.
DVDs. I don't know how at present they are available, but
They
if
have
you
just
get
made the
to,
websites now for available for purchase now.
okay, okay. So if somebody is searching for dissection videos, I will definitely recommend ACLANDS. Okay, and
Right.
if somebody is not, they cannot afford individually, one can have in groups. Okay, and
Definitely.
they can use it. So it's
Mm-hmm.
not like searching. It's better to buy in a group than to search in Telegram. I tell you, because you get
Right.
half of the content and half is not available. Then it's not
Yeah,
sufficient enough.
definitely.
So there are plenty of resources available, like grants dissector, or some other like SOBOTTA
Mm-hmm.
dissection atlases are available, so one can have it. The best thing is one can use the library.
Mm-hmm.
They are available because it is mandatory to have all these books in all the colleges. So
Right.
people have forgot to use the library. That is very ironical thing, because they never visit a library. They visit reading
Yeah,
room, they never visit stack room. They have to make a habit to find out these books, see them. If you like them, you can buy it personally or in a
true.
group.
True.
But at least you just make a habit to visit your library. There are journals available, and all the colleges, it is mandatory to get a subscription of all these journals. Okay, PubMed and all, it's mandatory. So colleges are paying yearly subscription for make it available free to use for all the students.
Right,
So whether
right,
it is a
right.
digital library or a physical library, plenty of books are available, and they are for students only. It's just the mentality of the student that they have to go, they have to visit, they have to spend some time, they have to
Right,
find out a resource material, and they have to use it.
right.
That is lacking.
Mm-hmm, mm-hmm. Awesome.
So that is what is about getting the resources. One more thing I would like to emphasize is that we were discussing about the association. Okay, integration, we have discussed integration. So for first MBBS student, the integration is okay, but like its association is bit difficult, in terms of you cannot have similar patients, like having say for example, you are studying brachial plexus injury, and you cannot have patient of Erb's paralysis. You just have to read Erb's paralysis or Klumpke's paralysis and something like that, claw hand and all, and you cannot get a patient on very same time. But what you can do is find out the related video of claw hand and just see how claw hand is there.
Definitely.
Not nobody is
Very important.
limiting you, nobody is limiting you to use the internet. It's a
Google is the
best,
best friend.
it's the best thing to use, but it's, it's been misused by
True.
the people. It's a boon, but it has turned out to be a curse. So just find out, instead of watching hours and hours in web series, just give some time in finding out the science. Okay, the sign what you are reading in surgery or medicine or in anatomy or in any subject, people are taking so much stress to prepare videos. Just use them. Okay, find out how a patient of claw hand or a patient of a facial palsy looks like. What are the signs they are eliciting in a patient of facial palsy? What are the signs? You will definitely going to get so many such videos, and you will definitely have a visual association.
Definitely.
So these are the things one has to make habit of. Whatever you read, whatever some applied anatomy person reads, it's not like in BD Chaurasia or Vishram Singh the content is enough. You should be curious enough to find out something more in Google or in YouTube. Make a
Hmm.
habit to find out something more relevant to it, and that will add upon the memory. Because if there
Definitely.
are two sentences are given for a given applied anatomy, you may not understand it properly, but if you go through it in depth by using YouTube or Wikipedia or something like that, then you will get to know something more about it, and that will help you in clearing your concepts.
Definitely. So, how would you comment on like working smartly rather than
Yes,
working like
this
on
is a
hard work?
smart work. This is an era of smart work, because we have said that it's a very, very sophisticated mechanism in human body. Very sophisticated thing. So much of intricacy is that, so much detailing is that one cannot complete the entire anatomy in first year, in 1 year.
True.
Likewise, you cannot learn entire medicine in third year. Is it possible? Tell me. Is it
Uh,
possible to learn surgery
Even
or
in first year, they're
23
like, yeah,
subjects? 23 subjects are being,
difficult.
it's not at all possible. You get only few months to read orthopedics, you get few months to read pediatrics. Is it possible
Yeah.
to complete
No,
the
no,
entire
no.
thing? Not at all.
In like first year, I remember they write about Wallenberg syndrome, which I could like understood after my internship.
So that is what I am saying, that whatever you read, whatever you prepare it very clear. It's not like you can have everything in your dish, and that will be an indigestion for you. You cannot complete entire anatomy or entire subject in
True.
1 year. Remember your limitation in terms of time, limitation in terms of resources, limitation in terms of your ability, because you are not
Right.
skilled enough to understand all these things. You
Right.
cannot, a first MBBS student cannot understand neurosurgery. It's their
True.
limitation of skill, limitation of their ability. So they have to gradually go through the process of learning all the subjects, and then they will become skilled enough. So
Right.
like one has to identify the core areas,
Mm-hmm.
like certain things they are supposed to, or these are termed as must know things. For
Mm-hmm.
any subject, certain things they are expected to know, that is a must to know things. So
Mm-hmm.
for that year they have to solve the previous year question papers, university question papers. They will come to
Right.
know which are the things very commonly asked, which are
Right.
the things which are useful for first year student,
Mm-hmm.
how much of the anatomy they are supposed to know.
Right.
Yeah, they cannot remember entire Gray's anatomy. Even they are not able to remember entire BD Chorosya. So what are the topics which are very commonly asked to clear, because they have to anyhow clear the anatomy. That is
Mm-hmm.
mandatory. That is mandatory. I'm not telling that they have to be conceptually very clear and they will just read only 10% of anatomy, they cannot pass. They have to read important topics. They have to find out the core areas. They have to develop core competencies. They have to know the must to know areas. They have to read them, they have to understand them, but what are the core areas? Once they have found, they should be thorough with those core areas. They are
True.
supposed to know these core areas. Then there are onto that certain areas. These are the areas termed as nice to know. If they
Mm-hmm.
know, it's nice, it's good. So if they find time, if they are curious enough, if they are free enough, if they are interested enough, they can go for some reference books, they can go for some extra things. Okay, but there are core areas and one has to develop that core competencies.
Right. Right. Right.
So
Right.
they have to reach to the faculties to, or they have to reach to the seniors, or they have to go through the previous question papers, and then they have to find out these many things are very important. These many things are
True.
very crucial. These are the things we are supposed to know, and then they have to focus on those things to clear first year. That is what I am saying. It's not like they can escape from other things. All the
Mm-hmm.
things will turn out to be useful, but at that particular time, in second year, in third year, okay, once it is necessary, like in orthopedic, they will again come to know about surgical anatomy, or they will come to know about classification of fracture. So at that time again the anatomy will be revised. Okay, but
Definitely.
that will be essential, or that will become a core competency of third MBBS, but
Hmm.
that cannot be necessarily a core competency of first MBBS. Okay,
Definitely.
so for first MBBS, what is a core thing they are supposed to know, and likewise in second year and third year regarding the core competencies they are supposed to know. Okay, so
Right.
this is an era of next exam. So many exams will be taken now, before internship, after internship, or something like that. So many things are being changed now from 2023 onwards. So they have to be prepared like since beginning. It's very
Right. Right.
essential. Again, the exam pattern is going to be changed, like application based questions will be asked now. Up to this point, memory based questions were emphasized more in MCQs, like what is the length of this thing, what is the
Yeah.
dialogue of choice of this thing. It's not like that. It's not
Yeah.
like
Yeah. Yeah.
memory is going to help you. It's like application based, clinical case scenario, clinical case based questions or logical questions will be asked. So if
Right.
you have enough concepts, good concepts, then that is going to happen. That is going to help you definitely.
Right. 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 So how can one prepare so that he can also prepare for next exam simultaneously, like for competitive
uh,
exams?
See, one has to find out the resources now. So many authors are working on it, that find out the resources which are providing you case based, clinical case scenario based questions,
Right.
application based questions, logical questions. Don't rely upon your memory.
Mm-hmm.
Okay, use your associated memory association, that if a patient of brachial plexus injury comes, then what will be the type of deformity he has and why this deformity is there.
Mm-hmm.
If you have crammed that there is a policeman's steep hand, that is not going to work. Why this policeman's steep hand is there? Why there is waiter's steep hand? Why there is Erb's paralysis? Which are the group of muscles which are paralyzed and the antagonists are working on it, and why this deformity has happened? If you
Right.
know that, then in any twisted manner, if Erb's paralysis is asked to you, you will be able to
True.
answer the
True.
question. So
Right.
it's not like students are nowadays remembering the things straightforward. If it is asked in a straight manner, they will able to answer. But if you
Yeah.
twist it a bit, they will stuck.
Yeah. If they just ask
So
about, okay, upper root is involved, okay, that's maybe
yes,
earth palsy. Okay, uh, baby
yes,
was delivered and harm is like abducted, then it's a
yeah,
problem.
yes. So one has to learn the mechanism to understand it properly. And for that, again, what we have discussed is one has to be curious enough.
Right.
One has to develop curiosity, because you are in medicine by choice, not by chance. So if you are by
True.
choice, if you are interested enough, then show your interest, find out the purpose of being in medical. Okay, and try to become a best doctor, try to get maximum out of it, and that will be not only making you a better doctor, that will be helpful in society as well. We need quality doctors.
It's inspiring.
We need
Inspiring.
quality doctors like Dr. Apurva.
Like Dr. Viren.
Oh.
So what are some
Yes,
of your
yes.
final words, Dr. Viren, about like students who are in first year of medical school?
Yeah, there are certain, I'm not saying that shortcuts, but there are some ways of remembering anatomy. So far as anatomy is concerned, I can tell you that you can make some charts, okay? And you stick to your study table, or in front of your study table, or in front,
Right.
just besides your mirror. One of my senior used to say that it is very difficult to remember the dermatomes of our body, front and back, all the dermatomes, their lines and their numbers, and it's a bit difficult.
Right.
So do one thing, take two printout, one in front, one in back, and stick on either side of your mirror. Okay, and whenever you see your face in mirror, or whenever you're combing your hair,
Right.
just have a look on both the sides daily. By the end of month, you will be thorough with that topic.
Definitely.
Okay, so whatever thing is difficult for you, revise it, repeat it, and the most important thing is of the memory. You would be knowing, Apurva, that we need a complete circuit. Okay, there is a Pape's circuit, so it's a short-term memory. If we want to put it in long-term memory, we have to not only give input to that information, we have to give an output of that information, and only way of giving output to that information is speaking.
Right.
More you speak, more you come out with that particular information, more it will be churning in your mind, more it is completing the circuit, and there are high chances of registering it into your temporal lobe for a longer period of time.
True.
Okay, so try to discuss with your colleagues, with your batchmates, with your friends in any medium, in one to one, in group discussion, in mobile. See, students are using mobile phones in chat with nonsense things, but what they can do is they can make a WhatsApp group, and they can do discussing the topic amongst that group.
Yes.
There should be WhatsApp group of discussion, group discussion.
Mm-hmm.
Okay, and they should put a topic, and then the students of all the group members should discuss upon that topic. Or in free time, in lunch break, or in evening hours when you are free, you should discuss the topic. One If there are two friends, then one will prepare a topic A, and one will prepare a topic B, and then if they discuss for 15 minutes in evening, both the students will be knowing both A and B topics thoroughly.
Right.
So this is a smart work. This is how one has to speak out. One of
Mm-hmm.
my one of my senior used to tell me, unless you speak, you will not able to recall it. So
Right.
why these faculties are thorough with the topic? Because they are teaching the topic regularly, and by teaching, they are speaking out. They are telling this topic. They are discussing the topic, and more you discuss, more you will be thorough with that particular topic.
Right.
So my
Right.
advice to the student is read, understand, make your concepts clear, and discuss with your colleague. Don't
Absolutely.
hesitate in discussing. More you will discuss. If you are sitting idle in dissection hall, just read and discuss the topic. Just see the topic, see the
Right.
dissection,
Right.
feel the organs, feel the tissue, and discuss the theory. That
True.
will definitely going to help you.
That was a comprehensive discussion about like how to study anatomy. That was, I
Yeah,
think, just a glimpse about like how you
yes,
can.
very
Um,
good. We can have a discussion for hours, but it's a time limitation. The
yes.
audience will get bored. So how much time they are discussing? Just skip. Let's skip the video. It's a scientifically proven. It's a scientifically proven. I'm again saying this to my students as well in lectures, that it's scientifically proven that human attention span has been reduced to just 9 seconds. I'm serious. It has been reduced to just 9 seconds, and so
It's
as
crazy.
all the social media platform have started making shorts, making reels, making status. It is just in seconds, 15 seconds, 20 seconds, 30 seconds. Why? Because the people cannot attend more than 30 seconds, more than 1 minute.
Wow, interesting.
It has just reduced to 9 seconds. They will skip for a fraction of second. They feel bored, they will skip it.
Mm-hmm.
So there is always a swipe option, and they are using it maximally.
I
And
think
for
that's just
that,
like 3-4 seconds.
yes, yes. And most of the time they use the thumb for
Mm-hmm.
swiping up. And so many patients are now coming up with the atrophy of adductor pollicis, dystrophy of the malfunctioning of this interphalangeal joint.
Wow.
It's a new deformity and new issue coming up with the patients by misusing the mobile phone continuously by swiping. See, always when you are swiping, you are using your thumb, you are flexing and extending your interphalangeal joint of thumb, and you are continuously holding something in your hand. So all the small intrinsic muscles of the hand, the muscles of the thumb, are continuously under stress.
Right.
There is no time of relaxing those muscles or nothing. We are not doing any exercise of intrinsic muscles of the hand, so they are continuously under stress, and patients are coming up with pain in their hand or pain in this interphalangeal joint. This is something new.
Wow. Interesting.
Patients are coming with back pain, cervical pain. This looks very funny that continuously we are watching down, we are looking down in mobile, and continuously we are stressing our back, cervical neck. Nowadays trapezitis is very common.
Yeah.
Back pain or spasm of the neck is very common, and it's surprisingly or interestingly, it has been given a name of text spine, text spine. More you text,
Mhm.
more you are injuring your spine. And it's a routinely used terminology in orthopedic, text spine. There is a patient
Right.
with text spine, then one has to think of he is overusing mobile phone.
Mm-hmm.
So this is not exactly an occupational hazard. This is something like misusing a gadget or gadget hazard. That is what I'm telling. Gadget hazard.
Right, right,
Misusing
right.
technologies and getting some issues with your body.
Yes.
That is all about Dr. Apurva.
Yes, I think that was a great comprehensive review at least for ignition, that what it takes to study anatomy. And I'm sure students will utilize the resources at their best, and we'll leave all the links in the description below of your channel, app, and all other resources as well. And still, if the students might have doubt, they can leave in the
Yes, they
description
can put
and
it in
the
comment
comments.
section, and
Yeah,
we'll try
make.
to address this in upcoming videos if possible.
Sure,
Definitely.
sure, definitely. Thank you so much, Dr. Viren, for your time, and it was so informative. And I'm sure students would be inspired to the next level.
My
And
pleasure. My
will
pleasure discussing with you. Definitely. Will
definitely, there's a great shape of doctors coming up, the new generations of doctors, just because of inspiration from you.
no, no. Anytime, anytime. I'm always open to address them, open to advise them. Anytime.
Thank you
Again,
so much.
nice meeting you. Thank you.
Thank you so much for your time.